Greetings, everyone. My name is Sarah Barnes, and on behalf of Campbell & Company, I'd like to welcome you to the release and panel discussion of the 2017 Giving USA report. Today, we are live from our Chicago and Seattle offices, and we are especially excited to have three special guests with us today: Sue Cunningham, Stephen Churchill, and Renee Nardone. Welcome, everyone. Before we begin today's presentation, I'd like to quickly review some logistics for those of you who may be new to our webinars. First, just to ensure that you have the best experience possible, close any programs that are running on your computer other than GoToWebinar, of course. You can call in using your telephone instead of using your computer speakers. Move away your cell phone from your computer, and if you experience any visual issues, send a chat to Campbell & Company. You may also contact GoToWebinar at 1-800-263-6317. Finally, today's webinar will last around 60 minutes, and you will earn one continuing education credit that is good for certification with CFRE International. About an hour after the webinar, you will receive an email from GoToWebinars that includes a web address to download your certificate, as well as information on how to sign up for our next webinar. Because this is a product of the Giving Institute, we are not allowed to post or send out today's presentation. We do welcome questions during the webinar, and if you are willing to be unmuted, we will have your question asked live. So please send your questions in advance by using the question panel to your right. And make sure to follow us on social media using hashtag GivingUSA2017. We will be actively posting throughout the week. And I'd like to take a moment to introduce Peter Fissinger and Kate Roosevelt. Peter Fissinger is the president and CEO of Campbell & Company. He has 31 years of professional experience in institutional advancement. He has worked in a wide range of nonprofit sectors, including education, healthcare, culture, and human services, and on campaigns with goals ranging from $5 million to $5 billion. He is treasurer of the board of the Giving Institute, a member of the board of managers of the YMCA of Metropolitan Chicago, a member of CASE, a past chair of Giving USA Advisory Council on Methodology, and a past president of the Chicago AFP chapter. Kate Roosevelt is the Executive Vice President at Campbell & Company, where she serves on the Executive Committee and oversees the firm's West Coast operations, including the Collins Group division. In her client work, Kate's intelligence and calm in the storm guidance has helped nonprofit organizations raise more than $500 million. Kate regularly presents on fundraising topics at local and national conferences and is an active member of the AFP Advancement Northwest. As a volunteer, Kate is a trustee of Colby College, her alma mater. She has also served in leadership positions on the boards of several Seattle area conservation and affordable housing groups. And with that, I am going to turn it over to Peter.
Thank you very much, Sarah. We're really excited to have you all with us this afternoon. Do you want to do a quick introduction of our panelists as well?
Actually, Kate is going to do that.
Okay, I'm sorry. Kate, can I turn it over to you to introduce our panelists?
I'd be happy to do that, Peter. Thank you. Good morning. We're really honored and pleased to have three leading experts in philanthropy joining us this morning for a panel discussion that will follow Peter's review of the Giving USA report. Stephen Churchill, the president and CEO of the Association for Healthcare Philanthropy, is with us. He has more than 25 years of experience in the fundraising and nonprofit world, and in his past positions has served as executive director of the American Medical Association Foundation, vice president of development alumni relations at Des Moines University Medical School, and director of major gifts at Simpson College. Stephen also served 3 terms in the Iowa House of Representatives and founded the Churchill Group to provide fundraising consulting services to nonprofit and political organizations. Sue Cunningham joins us as the 10th president of the Council for Advancement and Support of Education, otherwise known as CASE, where she landed in March 2015. Under Sue's leadership, CASE has reimagined its membership model and begun an ambitious strategic plan to better serve its members. A recognized expert in the advancement profession, Sue has 20 years of experience leading institutions, including the University of Melbourne, the University of Oxford, Christ Church, Oxford, and St. Andrews University. Our third panelist, Catherine Renee Nardone, serves as the Environmental Defense Fund's Chief Development Officer. She reports to Chief Executive Officer Fred Krupp and oversees all aspects of development and fundraising at EDF. Renee has a strong track record as a leader and strategist and nearly 30 years of experience in development, Board Relations, and External Relations. Prior to joining the Environmental Defense Fund, Rinnie served as the Executive Vice President of Coaching Corps, the Chief Development Officer of the Nature Conservancy, the Associate Dean of Stanford Law School, and the Annual Giving Director of Harvard Law School. So please join me in welcoming these three esteemed experts, and we're just very grateful to have the benefit of their experience and wisdom with us today. Back to you, Peter.
Thank you, Kate, and I want to extend my thanks to our panelists as well for joining us today. We really appreciate it. I also want to welcome all of you and bid you a good afternoon or a good morning if you are in the Mountain or Pacific time zones. I'm going to give an overview of the data that was released at 12:01 this morning. And I'm going to try to do this in about 20 or 25 minutes and then leave lots of time for a robust discussion within our panel that my colleague Kate will be leading. So just to take a look at what Giving USA actually is, we're tracking the 2016 contributions in this country by source and recipient type. We like to look at rates of change, not just last year, but over the last 2 years by both source and recipient type. And we use that data to look at some trends that are happening, trends that the data tells us and trends that we hear about in our panel discussions. There's a close connection between economic trends and giving, and we'll be observing some of those relationships during the presentation. We want to look at the longer trends in giving by source and recipient type, look at volunteerism in this country, as well as the number of nonprofit organizations that exist in the United States today. This is the longest running annual report on U.S. charitable giving. It gives estimates for sources of giving, the amount received by type of organization. It's published by the Giving USA Foundation, which is related to Giving Institute, a consortium of leading firms in our industry. The Giving Institute was formerly known as the AAFRC, the American Association of Fundraising Council. This research is made possible by contributions from Giving Institute member firms, foundations, and other donors, and also those of you who purchase the research through the Giving USA Foundation website. The research is researched and written by the Indiana University Lilly Family School of Philanthropy, and we're very proud of our partnership with the Lilly Family School of Philanthropy. So let's jump right to the data now. There was $390 billion contributed in this country last year, according to the research. That's an increase of about 2.7% when compared to last year in real dollars. It's the highest amount ever given in this history of this research anyway. Pre-recession high, adjusted for inflation, is about $360 billion, just to give you a comparison. All donor types except the bequest category increased last year. We think that the total increase is due to the $10.5 billion in increase in individual giving last year. And we believe that it's especially notable that giving increased at all since mega gifts, which are defined as gifts of $200 million or more and paid in cash, were reduced by half last year over the prior year, and that's largely, we think, a timing issue. If you look at the 5-year average growth, remember I said it grew 2.7% last year. Some are calling this modest growth, even though larger gifts were down and bequests were down. And the reason for that is that the 5-year average rate of growth for giving in this country has been 5.6%. There are two other factors I'd call your attention to before we move forward. First of all, this slide just really characterizes, maybe even more than you may immediately infer, the extent to which individuals drive giving. So we see the 72% of the total coming from living individuals. If you add the 8% that came through realized bequests last year, we're at 80% of all giving. And then in that foundation category, 15%, it's estimated that somewhere in the neighborhood of 8% of that is individuals who have created family foundations. And all told, giving from individuals or driven by individuals equaled 88% of the total. We also think one other notable factor, which I'll return to from time to time and may come up in our panel discussion, is the significant political and economic uncertainty that was going on last year that may have impacted giving to some degree. Although the evidence of this is somewhat anecdotal, we do have some good anecdotal evidence on that topic. I want to look at these individual categories. So if you look at giving by individuals, it reached almost $282 billion last year. That's a growth of 3.9% on the prior year. $1.5 billion in those mega gifts of 200 million or more. That again is down by about half from last year. You may note that the SP 500 increased 9.5%, which is an important indicator of individual giving. There were $5.6 billion in gifts of $1 million or more. And 50% of all this giving is estimated to come from what we call high net worth individuals. And for the purpose of that discussion, they're defined as people who have income of $200,000 or more and $1 million of more of invested assets. I might note that virtually all these people, at the risk of stating the obvious, itemize on their tax returns. And so when we look at the possible tax reform legislation going through, we're not as much concerned right now about the charitable deduction being preserved as reform that may result in a lower number of people itemizing on their taxes and whether or not that might impact giving. Some notable gifts last year: Michael Bloomberg gave $600 million to a variety of causes. Phil and Penny Knight gave $400 million to Stanford University. Paul Allen, $295 million to a range of causes. And Larry Ellison, $200 million for medical research. Giving by foundations last year finished at a little over $30 billion. That's a decline of 9%. Excuse me, I'm on the wrong slide here. I meant to be at giving by bequest. Sorry, it finished at a little over $30 billion last year, a decline of 9%. If you look at this graph, as well as if you followed the research, you know that giving by bequest can be quite volatile, and it really depends on how many very large bequests happened in a given year. Last year, there was one bequest of $400 million from the estate of Howard and Lottie Marcus as the only bequest that exceeded $200 million last year. And you may, many of us who follow this note that we're in the midst of an unprecedented intergenerational wealth transfer that's estimated in the trillions over the next decade or two. When we look at this slide, we like to just remind folks that even though the bequest category is driven by very large bequests, what really matters in most organizations is how hard you're working on a regular basis to build a bequest program, how you recognize and steward those bequest donors, because you don't have to be worth $1 billion to leave a bequest to an organization, and we see many nonprofit organizations thriving through a healthy bequest program. I'm going to have to go back to foundations now. The slides are just a touch out of sequence here. So giving to foundations finished at $59.28 billion last year, an increase of 3.5%. That's the 6th consecutive year of growth. Independent foundations, which comprise 76% of the total, accounted for 2.3% growth. Community foundations grew by 9.9%, or $7.7 billion, and operating foundations grew by 4.5%. This increase in giving by foundations over time, and that's a pretty steep ramp that you see on this slide, is largely due to the growth in assets that foundations have. Some of that comes from good management of assets, but a lot of it represents this migration of giving from the individual category into the family foundation category and into the community foundation category. Giving by corporations last year finished at $18.5 billion. That's an increase of 3.5%. Corporate pre-tax profits were up 2.7% last year. If you look at the last 10 years, giving by corporations has averaged 0.8% of pre-tax profits. So that's an important relationship between an economic indicator and giving by corporations. The GDP also increased by 3% last year. We are seeing corporations give more money overseas, while the total giving is still driven by cash giving by corporations. We see in-kind giving rising over time. This is dominated, in-kind giving on a percentage basis is dominated by giving by pharmaceutical companies overseas, giving their drugs away. That total is estimated by some to be as high as $7 billion last year. So if you look at the giving by source in the macro over a 2-year period, what you're able to see is that giving overall in the last 2 years has increased almost 7%. Giving by individuals, and these two categories are usually closely aligned because of the extent to which giving by individuals drives the overall pool, finishes up 8% over 2 years. Foundations also up 8% over 2 years. Bequests see that significant rise and then decrease, resulting in a decrease of 2.3% over a 2-year period. That volatility is common in this category over time. And then over a 2-year period, corporate giving went up by 2.7%. So when you look at these different categories over time, starting in 1977 and going all the way up to today, what do we really see? I think what we largely see is very consistent stability in giving and where that giving comes from, with the caveat that foundation giving has grown from 6%, you can see in the 1977 to 81 pie slice, to 15%, and that accounts for a decrease in the individual giving. But if you account for individuals migrating their giving into different ways, I think that what you see is very consistent results in terms of the sources of giving over the past, since 1977. Let's look at where all that giving is going. And let me just say that last year, for just the 5th time in the history of this research, all of the recipient categories increased in the amount of philanthropy that they experienced. And so when you look at the larger pattern, what you see here is giving by religion getting 32% of the total last year, giving by education 15%, human services 12%, gifts to grant-making foundations 10%, health 8%, public society benefit 8%, and then arts, culture and humanities, international affairs, and environment and animals, those last 3 categories, all in the 3 to 6% range. So let's take a closer look at some of these categories. Giving to religion finished at almost $123 billion last year, which is the highest amount in the history of this research. It increased by 3%, and this is the 6th consecutive year that this category has seen an increase in philanthropy. However, if you look at the 5-year average of growth in this category, it's the slowest amount of growth of all 9 categories. So what does this include? First of all, it includes congregations, houses of worship, national or organizing religious entities, missionary societies. And so when we look at the slower rate of growth, there are 2 theories that are emerging, both of which probably have some validity. The first is just the overall decline in membership of churches and synagogues, people who go to their house of worship every single week and therefore maybe make a donation and have strong relationship with their house of worship. And there just are fewer people in the country that do that today as compared to 10, 15, 30 years ago. The second piece is there's a growing level of concern among ourselves, and by that I mean Giving Institute, Giving USA Foundation, Lilly Family School, that the methodology for accounting for religious giving could be improved. And so we've actually invested some money in improving this methodology to see if we can get a more clear result. But we do believe that at a minimum, the growth in giving to religion is declining over time. Giving to education, I'm going to be interested to hear from Sue on this topic. I frankly was surprised at the results. It finished at just under $60 billion. That's a growth of 3.6%. To give you some comparative data, giving to education grew by 8% last year, and its 5-year average growth is 6.9%. And so given the strength of the market 9.5%, and the SP 500, the GDP growing. I personally expected the result to be a little bit higher than it was. We do think there is a relationship to the lower number of mega gifts. There was one to education, I believe, last year, and I know that there were 3 or 4 gifts of $200 million or more to educational organizations the prior year. Over 41% of all gifts of $1 million or more go to the education sector. And so there are a lot of very high net worth people who really believe that giving to education is the best way they can advance opportunity for a broad base of people. And so we see a lot of big gifts going in that direction. And we also see educational organizations with more sophisticated major gift programs in a lot of other sectors that we're reporting on today. Giving to Human Services finished at just under $47 billion, an increase of 4% over the prior year. This is the 3rd consecutive year of growth. We think that we have noted a relationship between national disasters and giving to human service organizations, and there were not as many, thankfully, big national disasters as we've seen in prior years. The other thing that I would observe about this category is when we look at how individuals drive giving, a lot of the other categories are categories where there's a very distinct and clearly defined relationship between the donor and the entity. If I attended college, I may support my alma mater. If I have a family member who was sick, I may want to support the hospital that cared for that family member. If I am a regular subscriber to my favorite theater or orchestra or opera, then I may be supporting those entities. Human service organizations, the donors are very seldom recipients of the service provided, and so they have to work a little harder to develop individual relationships relationships with individual donors. Giving to foundations last year finished at $40.56 billion. That's an increase of 3.1%. This category was actually down the prior year, and it has, so it's recovered somewhat from the prior year. The larger trend here, as I noted earlier, is that individual giving is migrating to some degree into this category. Family foundations and donor-advised funds that exist at community foundations are places that people are placing some of their wealth to institutionalize their philanthropy, frankly, to get, in some cases, to get a tax break for money that they may give away later, but also to include very often family members in giving decisions and try to pass the tradition of philanthropy on to children and grandchildren. Giving to health last year finished at $33.14 billion. That's an increase of 5.7%. It's the 5th consecutive year of growth with a 5.2% average over that 5-year period. So this is very much in line with the kind of growth this category has seen in recent years. Medical care and medical research account for 12% of all gifts over $1 million last year. And so this is another area where there is some very sophisticated major gift fundraising programs and high net worth people who are being very strategic and making big investments in things that they'll have that they believe will have an important impact in the quality of life. This category includes hospitals, primary care facilities, health-related research facilities, disease-specific organizations, mental health organizations, and patient support entities. Giving to public society benefit finished at just under $30 billion last year, an increase of 3.7%. That's the 7th consecutive year this category has grown. The 5-year growth rate is 5.6%, and this is the smallest growth rate that public society benefit has seen in the last 5 years. We get a lot of questions about what's in this category, and so I'm going to answer that, but let me just let you know it's kind of a long list. So we have voter education organizations, civil rights and civil liberties organizations, consumer rights organizations, economic development organizations, freestanding research institutes, organizations that raise money to distribute to other organizations like the United Way, the Jewish Federation, and then finally, and very importantly, donor-advised funds that are in national organizations, many of these being for-profit entities. And it's estimated that that category, that group accounts for 9% of this total. By the way, there was some research done over the past year that estimates, because some are concerned about how much do people actually give out of donor advised funds, because there is not a minimum. The research that I saw that was attached to the Giving USA research, it was not the Giving USA research, it was just cited in a summary, said that the payout rate for donor advised funds averages at the 15 to 20% range nationally. So that's a very interesting statistic, I think. Giving to arts, culture, and humanities finished at $18.21 billion last year. That's an increase of almost 6.5%. The 5-year average growth rate is 5.6%. So a very good year for this category of organizations. You know, if you look at this data over the long-term history would suggest this is a good time for arts and culture organizations to be launching campaigns and building their major gift programs. The arts and culture category does follow the stock market more than some other categories, does experience big gifts like the $400 million gift made by Stefan Edlis and Gail Neese to the Art Institute here in Chicago. And so what we see is when the economy has been strong for a while, that arts and culture organizations get some big gifts and have some very successful campaigns. So that history suggests this is a good time for these organizations. We've also noted that they've become increasingly sophisticated in using technology and to reach out to their members and donors. One example is an organization using the technology capabilities of phones to track where in the museum subscribers are going to look at art, and then either changing the pattern of how they're hanging the art in the museum, or reaching out to donors to talk about that specific exhibit, which is very interesting if you think about how they're adapting to the available tactics according to technology. Giving to international affairs finished at $22 billion last year. That's an increase of 5.8%. It's the 6th consecutive year of growth. There's an 8-year average over that time period. So it's actually a little slower growth than some other years for this sector. This is the fastest growing sector in philanthropy. Now, it's a smaller piece of the pie, so it's easier to grow fast when you're a smaller piece of the pie, and there are an increasing number of international organizations. These are organizations that provide international aid, international understanding, peace and security, foreign policy research institutes, international human rights organizations. Giving to the environment, very interesting result here. Finished at $11 billion last year. Be interested to hear from Rini on this topic. An increase of 7.2% over the prior year. The 5-year growth rate is 6.4%, and we are seeing increasingly sophisticated major gift programs in a wide range of organizations that are supporting environment and animals. I talked about political and economic uncertainty. Just some examples of the political climate. Last year, the Sierra Club reported that they had 7,500 people become monthly donors from election day to the following Monday. So that's less than a week's time. The Center for Biological Diversity received $400,000 in new gifts on the 16th of November. Earth Justice received $11 million shortly following the election. And so there is clearly some impact in giving going on here related to the current political climate. And I know that Rini will be able to tell us more about that. So if you look at the 2-year results, what we have is religion going up 6%, education going up 12.5%, even though it grew modestly last year. Human services, 8.1%. Foundations actually down because of a deep dip the prior year. Health up 6.3%. Public society, 10.1%. Arts, culture, and humanities up 12.3%. International affairs, 20.7% in 2 years. And environment and animals, 13.5% increase in giving in the last 2 years. So this is a much more complicated slide that I have in front of you now, and it shows these destination categories going back to 1977. And let me just point out a couple of quick things. The top category that says 32%, that's religion. You can see it declining from 52% and then 58% in the 1982 to 86 range, down to 32% today. Foundations, we talk about that migration of the manner in which individuals are giving. Foundations increasing from 4% back in the 1970s to 12% today. Arts and culture continuing to, growing and increasing its share of the pie over time. And then environment and animals and international affairs were not even part of this research in the beginning. So they've actually emerged as destination entities for philanthropy. I want to make a couple of comments about the relationship between the economy and giving. This first slide just shows total giving over time. And what you're able to see is the dark bars are times when the economy is growing, and the lighter bars are times when we're actually in recession or the economy is not growing. And what you're able to see here is that when primarily the stock market, because a lot of philanthropy comes through invested assets from folks who want to give as much as they can to their favorite charity at the lowest cost possible. So you see these rising bars in the last 4 years, and you see that real steep growth in the 1996 to 2000 era. And you're able to see a relationship between the economy and the rate at which it's growing and the results in philanthropy. Here's a slide showing the relationship between the SP 500 and total giving. And it might seem hard to follow at first, but what I see in this slide is that giving follows the S&P 500, but not as dramatically as the S&P 500 may rise or fall. And so if the stock market goes up a whole lot in 1 year, people don't all of a sudden give 50% more, but over time, they increase their giving. And if the stock market drops precipitously, giving doesn't go away, but it may decrease, but it'll decrease more slowly over time than the market volatility shows. There are some who believe that disposable income is the most clear indicator of individual giving, and it finished at 2% of disposable income last year. And you can see going back to 1976, we were at 2% of disposable income in giving results. And then if you look at corporate giving, I said that over a 5-year average, or the last 10 years, excuse me, corporate giving has averaged 0.8% of pre-tax profits. And you can see this history between 76 and 2016. And there's a clear link between pre-tax profits for corporations and the amount they give in any given year. And then if you look at giving as a percentage of the gross domestic product, you know, there are some who believe if we could just move this needle, it would impact giving, but giving is still, unfortunately, a relatively small part of the overall gross domestic product. So it's not so easy to go up 2, 3, 4% in this total, but it's always been hovering somewhere in the neighborhood of 2% of the gross domestic product. We've actually raised that up since the beginning of this research, and I think that's something we can be proud of. A couple of other things I want to talk about. So just briefly, I've noted these relationships between the economy and giving, but that doesn't mean that there isn't any difference that we can make in the ways in which people give and in representing the mission of our organizations. And so one way is to engage as many volunteers as possible, bring those volunteers close to the mission of your organization, and ask them to support the mission financially in addition to supporting the mission through their time as volunteers. 62.6 million people reported that they volunteered at one of their favorite nonprofit organizations last year. And I can tell you straight from my own household that there's a direct relationship between where we as a family volunteer and where we make our philanthropic investments. So please keep that in mind, that volunteers are something to be treasured, supported, cultivated, and they will support your organization if you ask them to do so. And then the number of nonprofit organizations that exist, 1.237 million nonprofit organizations. So if you ever for 1 minute thought you weren't in a competitive environment, you may want to reconsider that point of view. And I usually end with this slide, and the reason that I do is that there are so many worthwhile organizations out there, and we're really proud to be working with many of you. and proud of the work the rest of you are doing. But please note that donors have choices, and let's really cherish our volunteers and our donors. Take very good care of them. This number tells you that others are calling on them and asking them to support their cause, and a lot of those causes are worthy causes. So we are in a competitive environment. And with that, Kate, my colleague and friend, I'd like to turn it over to you for the panel discussion.
Kate, are you there? I just had to unmute you. Sorry about that.
Thank you. Thank you. I will rewind. Peter, thank you so much for running us through some very interesting information on the state of giving in our country. And as we have done in the past, we're really happy to now take the data and ground it in the real life experience of leaders in 3 sectors that have received just over a quarter of the giving that we experienced in the U.S. in 2016. Really significant sectors of education, healthcare, and the environment. Over the next 40 minutes, what we're going to do is ask each of our panelists to share some more information about their organizations and some of the topics and issues that their sectors are examining as it relates to philanthropy. And then we've identified a half dozen or so topics that we're going to talk through together so that you all can benefit from, again, the wisdom and experience of some of these leaders. And we'll wrap up and leave about 10 to 15 minutes at the end of our session today to hear from you, from the participants who've joined us today, about what questions all of this research raises for you, and to the best of our collective ability to answer those questions for you. So I'd love to start with Sue Cunningham from Case, and welcome, Sue. Would love to hear from you for about 5 minutes about what's happening at Case and some of the issues that you and your colleagues are thinking about these days as it relates to philanthropy in the education sector.
Well, Kate, thank you very much. And can I add my thanks to the Giving USA contributors who make it possible for us to see the depth of data that's come out early this morning. And for Case, whose membership numbers over 3,700 educational institutions in the US and in 81 other countries around the world, with about 85,000 people working in those institutions who, as part of Case member organizations, are committed to advancing education, that the information we're receiving here is really important. And as you know, our members work across several fields, across marketing, across communications, across alumni engagement and advancement services, and of course around development and fundraising. And there are a number of things that stand out to me in the information that we're receiving today. And one is, you know, this is a tribute once again in 2016 to the huge commitment and philanthropic contribution that is being made to US institutions from citizens of the United States and of course from outside the US. And I look forward to maybe exploring that a bit later on. But the extent of generosity is humbling and magnificent, and something I think that is a cause for celebration. Where our membership is concerned, and we're looking at education and the areas that Case is focusing on right now. As part of your kind introduction, you mentioned the fact that we've been through a very substantive planning process for Case about 18 months, 2 years ago, which has resulted in a strategic plan with about 2,500 of our members and volunteers around the world contributing. And out of that has come some really core areas of focus, one of which is focusing on talent management, another is focusing on thought leadership and research and the work that we're doing in that space. A third is really around member engagement and how we're supporting our members. And a fourth is really what is the value of being a global organization with membership in many different parts of the world, and how is the fact that we have members in those different parts of the world advantageous to everyone as the world is becoming increasingly flat and communications and connectivity and education is at the heart of this, is becoming incredibly fluid. coming back to these shores, I think that some of the areas that have been occupying our minds and that have already been referenced in part in Peter's excellent introduction. One is around what the sort of state of play was in 2016, and we took a quick snapshot in anticipation of this conversation at what had happened to the figures for giving to education in previous election years. The point about, has this created an era of uncertainty or instability? And certainly some of the conversations with our member institutions last year was there was an element of waiting and seeing and people being pausing for a while around their philanthropy whilst they waited to see the outcomes. And if one looks, for example, at the year 2000, there was a 2.6% increase in philanthropy. In 2008, it was a 5.5% decrease. And as we know, this year, a 3.6% increase. So relative to the figures for 2015, as we know, this represents a lesser increase. But that said, I think there is an evidence that in election cycle years, that is a contributing factor. That said, the fact that over the last 2 years there's been a 12.5% increase in philanthropy to education, I think is a tribute to the donors. It's a tribute, of course, to the hard work of institutional leadership and staff, and finally, of course, to the volunteers and alumni and supporters who are contributing to make a difference. And finally, Peter, I really love your slide on volunteerism. Cases can only do all that we do because about 4,000 of our members each year volunteer. So I'm completely on board, and I think it's a critical aspect of the work that all of our professionals are doing.
Thank you, Sue, for that wonderful introduction, and look forward to hearing more of your thoughts in just a few minutes. Welcome, Steve Churchill from the Association of Healthcare Philanthropy. We're delighted to have you with us today, and would love to ask you to share a little bit more about what AHP is up to and some of the issues that are on the minds of your member organizations in the healthcare sector.
Thank you for inviting me to join you, and enjoyed your comments, Sue and Rini. Association for Healthcare Philanthropy is members are fundraising professionals that work at hospitals, hospices, and long-term care providers. We have nearly 5,000 members in the United States and Canada, and we provide education, training, tools, resources, and certification for our members. And when I think about the top 3 issues that are facing our industry today, or top 3 key focus areas, the first would have to be grateful patient fundraising. The difference between those who work in the healthcare sector for hospitals, hospices, and long-term care providers and universities like Sue has is that one of the real challenges is just identifying who the prospective donors may be. If you work for a university, it may be more obvious that you start with alumni who have had a long relationship with your institution. For hospitals, really patients are key stakeholders and constituents and their families. And so we continue to see a focus on grateful patient fundraising. It's becoming more sophisticated, and it's also an issue that some ethical questions have been raised about. Of course, at AHP, we see grateful patient fundraising as really important, but we have identified a group of individuals who are going to look at the ethics associated with grateful patient fundraising. So Steve Rum, who is the leader of the Chief Development Officer for Johns Hopkins in Baltimore, is bringing together about 30 fundraisers, ethicists, hospital CEOs, and donors together for 2 days at the end of this month to put together some information that will result in a white paper. And the substance of the white paper will be to produce ethical guidelines related to grateful patient fundraising. The second key issue for our members is systemization. The rate of systemization is not slowing down, and so you see more and more systemization happening, meaning that there are more hospitals and healthcare providers as a part of one entity. And so we are doing some research as a part of our Content Advisory Council in terms of what impact will systemization have on fundraising? How will that affect the results in the relationship between the donor and the institution? And then finally, the third key issue dominating discussion in our sector is the Affordable Care Act and how that changes that Congress is looking at making will affect hospitals. We know that the American Hospital Association has weighed in on the issue, but it is creating some uncertainty for hospitals. Many hospitals are challenged in this economic environment. Some of the largest systems are seeing negative operating levels. And I think really what the challenge to the hospitals is just the uncertainty. Now, certainly development shops and hospitals want their parent organizations to be profitable, and that uncertainty can mean a reduction in staffing levels for development offices or opportunities for education. But it can also mean that hospitals will depend more on their development offices, their foundations, as a dedicated source of revenue. So it can have an upside as well in terms of making fundraising more vital and important to those institutions. So grateful patient fundraising, systemization, and the Affordable Care Act are three issues that are really important to our members today.
Thanks so much, Steve, and also look forward to hearing more of your thoughts as we move into some of our questions. Third, I'd like to welcome Rennie Nardone from the Environmental Defense Fund. Rennie, we've asked you to represent the entire environment and animals sector, so thank you for stepping up to that challenge, and we'd love to hear a little bit more about what's happening at EDF, as well as any observations you have about what you and your colleagues across the sector are thinking about these days.
Well, thank you, Kate, and thanks to my fellow panelists. And Sue, I spent 20 years as a proud member of CASE before moving on to the quote-unquote animals and environment sector. And we're very happy about that, moving up from the 2 to the 3% that we've managed to accomplish over time. I'll say a little bit just to give context about EDF, and then a little bit about the scope of our fundraising program. So for those of you not familiar with our organization, we currently have formal offices in about 10 US cities, in 2 countries, in London, in the UK, and in China. We have staff working in programs in another 8 countries. EDF was founded exactly 50 years ago, nearly to the day, by a small group of scientists concerned about what was happening with DDT. And so EDF got its start with the banning of DDT, and we always refer to that as our, sue the bastards era. That was what kicked us off. EDF moved on to issues like acid rain and was the pioneer really in market-based solutions to environmental problems. And for those of you too young to remember acid rain, essentially what was put in place to deal with that very critical environmental problem was cap and trade, something that we've talked a lot about in terms of how we deal with CO2 and other climate contaminants. We are an organization that we work in the field, we work with partners, we work with governments, and I think a very important thing to understand about EDF in the environmental space is critical to our mission and the accomplishment of our mission. Our tagline is "Finding the Ways That Work," is that we work in a bipartisan fashion. And we'll touch on this a little bit later, but that's been a real a matter that we've really had to do a lot of examination around in the current environment. If you're interested in learning more on the web at edf.org, we have our Blueprint 2020. Back in 2014, we embarked on a very comprehensive assessment of the full landscape of what was going on in the environmental space, and where EDF could focus its efforts and have the most impact. And the result of that strategic assessment was our Blueprint 2020 plan, which gives you a comprehensive view of where we're focusing our efforts. Our fundraising program at EDF is top to bottom. We are a very strong principal gifts fundraising operation. We have a very strong membership program. We have, 85 staff raising roughly 160 to 70 million a year. And the organization overall is about 600 staff. So Kate, and I'll turn it back to you with that.
Thanks so much, Rennie, and again, thank you all for being with us today. So moving into some of the hot topics that we've identified for discussion today, I want to start with what might be the most obvious one, but certainly not lacking in complexity, which is, given the dominant role of individuals in U.S. philanthropy, it would be great to hear from you how you're thinking about the donor pipeline in terms of donor acquisition and retention, what you're experiencing overall, and then perhaps even at various donor levels. And Rennie, I might ask you to jump in here first, because like some of the organizations that Peter cited in his data review, I know that EDF has had some pretty remarkable experiences since the November election. So fill us in on what's happening and how you're thinking about the donor pipeline these days.
Yes, so I'm going to focus primarily on our membership. That is one source of our pipeline, and it's a significant source of our pipeline. But in terms of response to recent events, that is where the most action and activity has been. So just to give you some context for what we've been seeing in our membership numbers, in 2016, we are on a October to September fiscal year, which is sometimes a little challenging. And my numbers are going to be as of the end of April. So we're talking 7 months into our fiscal year. So I'll just a touch past our halfway point. In our membership funding, we have seen a 60% increase year to date in our membership revenue. So in fiscal 16, we were at roughly 17.3 at this time, or at the end of April. At the end of April, 17, 19.5. So that's a very, or excuse me, I said those numbers wrong. We were at 12 million at the end of April, and now we're at 19 million. So that is a very significant increase. We actually closed out our fiscal year last year in our membership fundraising at 17.3. So we're already 13% over where we were at the close of our year end. Our actual donor counts are up 30%. And where have we seen the bumps? This is not a surprise. It was immediately post-election, at the inauguration, at the appointment of Scott Pruitt as EPA administrator, and then most recently, for those climate geeks out there, it was defeating the Senate's vote on overturning some methane emissions rules on federal lands. And so this really, we got smart at a certain point and started seeing our opportunities and when they were coming and really planning accordingly. One of our challenges, and I alluded to this earlier, has been we are very strongly bipartisan. We work on all sides of the aisle. We cannot come out with the same kind of messages that some of our peer organizations within the green space can come out with. And that's been a real point of not contention, but debate around how far are we willing to go? What are we willing to do? We aren't NRDC, we're not the Sierra Club, and we need to maintain that bipartisan stance in order to accomplish our mission in the way that we do. And so sort of saying, can we sacrifice, so that we can maintain this has been the choice we've made. And also keep in mind, our board is very bipartisan. It's very sort of 50-50. Republicans, Democrats, our C4 board likewise by design. And so we really have had to address, internally do a little soul searching around this, which has been an interesting exercise. We have been looking very carefully at how we retain these donors. We know very much that the, what did they call it, philanthroactivism or whatever, where people give quickly in response to events and then drop off, is a very strong phenomenon that we would like to avoid. So we're looking very carefully in our acknowledgements, the messages that these first-time donors are getting, at our newsletters, how we're addressing the reasons that they signed on, in our resolicitations, and in our attempts to convert folks to monthly sustaining donors. And Peter referred to Sierra Club's new sustainers. We've seen almost doubling the share of our sustainers, and now we're working on those first one-time donors to reach out personally to sign them on as sustainers. But the key messaging for us in this environment is giving people hope that their funding will enact the kinds of change or prevent the kinds of rollbacks that are the reasons that are motivating their gifts. And then just one more comment I will make about the acquisition. Ours has been largely online. It's been largely in response to social media buys where we have pop-up ads. It has been in, the cyber equivalent of white mail, where it is literally coming in over the transom to our website. So while we have invested a lot in recent years in fine-tuning our social media outreach to acquire donors and to get out messaging, and we have been fairly aggressive in our more traditional channels of acquisition, we fortunately have laid the groundwork in testing out some things to enable us to really capitalize on this moment, for better or for worse. And so with that, Kate, I'll turn it back to you.
Thanks so much, Rinny. Fascinating experience, and it'll be just a great case study to see what happens over the next couple of years for sure. Sue, from the perspective of the Education Center, we have some data that tells us that online giving in the education sector is performing in some interesting ways. Acquisition is down, but retention is up. And then, as you alluded to in your opening comments, I think there's just a really interesting conversation to be had about the geographic sort of distribution of donors, and just would love to hear your comments on those two topics as it relates to donor acquisition and retention in the education sector.
Sure, thank you very much, and happy to do that. And Rinny, lovely to connect with the 20-year member of CASE, and congratulations on your important work. So in the context of pipeline, I'd say a few things, and Kate, thank you for those prompts. I mean, one I'd refer to is obviously in terms of acquisition and engagement, the role of student philanthropy, and this is something that is very vital and alive in the educational sector. And CASE has an affiliated student advancement program where we have students coming together to share with each other best practice, and this is a really growing and burgeoning area. Reflecting on online giving, and we see more and more and greater use, of course, of social media by our members across sectors and across countries. And you're right, the Giving USA provides some really interesting statistics. For example, one of them I thought was particularly interesting was that 73% of millennial alumni want to receive emails from their alma mater. And, that speaks to the fact that the social media and the point on retention is as much, I would argue, around engagement and stewardship as it is around fundraising. And we're seeing through crowdfunding and giving days that the fundraising aspect of it and the engagement aspects are really beginning to produce impressive results. The Blackboard data, for example, that indicates that philanthropy through social media is up 13.2% in higher ed and 9.8% in K through 12. So I think this is a space that we will continue to watch and work on with our members as it grows and develops, and watching the innovation that's happening, which is very exciting. The second area that you referred to is that of international, and in a US context, there has been a steep incline in recent years in the number of international students at US institutions, An Open Doors survey demonstrated that something like 5.2% of undergraduate students in the United States are from outside the US now, with over 1 million students now from outside the US. And clearly that has implications in terms of where alumni are, where parents are, and of course, philanthropy knows no borders, so where there are philanthropists and foundations in other parts of the world who care deeply about the work being done by institutions in the US, this is increasingly representing opportunity. And we're seeing some significant gifts now coming to institutions in the US from Asia in particular, but also many of our institutions have charitable giving vehicles, charitable trusts in the UK and in other parts of the world as well. So I think this is an area where we're seeing more happening, and I think it's an exciting and important development. Of course, it works the other way as well, with many US philanthropists giving to educational institutions in other parts of the world.
Thank you, Sue. Steve, in the healthcare sector, we had an interesting conversation prior to this call about some of the shifting focus that's happening in the healthcare sector. Would you like to spend a couple minutes commenting on that?
Sure. You know, I think that traditionally, in terms of the pipeline, the first line of defense has been the annual fund, and I think that is shifting a little bit. I mentioned grateful patient fundraising earlier. We're seeing a greater emphasis on grateful patient giving. It's a logical constituency for our sector, becoming more sophisticated, especially when it comes to major giving. And it's really involving all individuals that have contact with the patient and their family, not just the physician, but nurses, others in the hospital, and the development professional as well, in a very thoughtful way for people that have been really impacted by the care that they receive. And so as direct mail becomes less meaningful in our sector, and that's impacting annual giving, but it's still important to have engagement, and it's still important to get donors, first-time donors, and smaller gifts in the pipeline that might translate into larger gifts. And so we're seeing events as a tool, not so much for fundraising as they've been in the past for the charity gala, but for friend raising, and yes, bringing dollars in, but getting people engaged with the connection and connecting with the organization. And then, of course, we're seeing growth in online giving, both in terms of crowdfunding and social media, as a way of keeping people connected with the mission and vision of the organizations in their community. So those are a couple of observations in terms of the pipeline.
Thanks so much, Steve. Kind of continuing on this theme of individual giving and dialing it up to perhaps a different level, Peter, shared in his review of the data that we know that in 2016 the role of mega gifts was not as robust as it has been in previous years, and I think Sue, it'd be really interesting to hear from you to start us off here about does this data jive with your experience in the education sector, and what do you make of this this result for 2016, and what do you think it means more generally?
Thank you. And I think, obviously there's a close connection between the really mega gifts, and obviously there are different interpretations of what a mega gift is in terms of value, and the really big capital campaigns that we see continuing to grow and be more ambitious and be successful, which is hugely impressive. But if one looks at the really significant gifts, there was an article not long ago in the Chronicle of Higher Education that listed that there were 10 gifts in 2016 of $100 million or more to higher education. And as we're looking at 2017, which obviously we'll be talking more about at this time next year, I hope, so far for 2017, there have already been 7 announcements of gifts of that scale. So I think this trend is actually moving forward in a way that is reassuring. What I would say, of course, is that inevitably the scale of these gifts have a significant, any individual gift at this kind of level has a significant impact to the overall figures. And the other thing I'd say is that we know that these gifts take a huge amount of time and focus and energy, where relationship and stewardship and investment in building those relationships over a significant period of time are all critically important. And therefore these things do not happen overnight. They take a considerable amount of time. So my reflection on the significant gifts and on the campaigns is that there's a lot of hard work being done, and there are remarkable things being achieved, and that there are philanthropists who are contributing at these significant levels. And Peter just listed a number of the really substantial gifts is very impressive. The other thing I'd say is that, we have members working in different sectors, from independent schools to community colleges to four-year institutions. And significant gifts, obviously, the term significant or major or mega means different things in different institutions and different types of institutions. And I just wanted to sort of indicate that the community college sector, in which we've seen significant growth of ambition and commitment in the world of advancement and in philanthropy, Case does a fundraising index, and in the context of that index this year, there's been a higher level of growth in philanthropy at 7.2% for community colleges than any other sector. We're not talking about the 100 million, 200 million gifts, but there are some really significant gifts coming through for community colleges, which I think is an indicator of how hard they've been working and how much progress is being made.
Wow, thank you. That's great to get some insights into the different dimensions of the education sector, and that last bit on community colleges is especially interesting, Sue. Thank you. Steve and Rennie, is there anything you'd just like to comment on related to the role of mega donors in the healthcare and environmental sectors? Steve, we can start with you.
Sure. Well, I think that the trends are similar for healthcare philanthropy, in that we're seeing fewer donors overall, but of those who are giving, we're seeing some larger gifts. And, the 80-20 rule that we've counted on, 80% of the gifts come from 20% of the people, I think has moved to the 90-10 rule. Again, grateful patient fundraising is an important source of support for our institutions, and that training to provide meaningful interaction between all those that come in contact with the patient and their families is really important, as I mentioned before. And as I said, AHP is holding a Grateful Patient Summer later this month, because we do want to make sure that we're providing clarity to our members in terms of ethical guidelines, and our members are really seeking that in terms of a standard of operation. And that will be something new that I think will provide some clarity to all those that are involved in our sector.
Thanks, Steve. And Rennie, I think more generally in terms of the environment sector, I would assume that the sort of the scale of mega gifts is perhaps a bit different. So how do you think about that in your work, and what are some of the opportunities and challenges for environment organizations when it comes to big gifts?
Right. So in the past, a lot of those very large gifts have been driven by the land trust organizations, who now, by and large, also acknowledge that they can't buy it all to save it all, and are moving to different means to accomplish their missions. And so the scale for us of what you would define as a mega gift, since we're not building facilities by design, most of us are not looking to build endowment. There aren't those same kind of concrete opportunities that can give you a large naming opportunity, just a large point of focus for that kind of capital. So for us at EDF, we're talking more about something that's in the range of 50 to 100 million over a 3 to 5 year period. That's more or less what we see as the scale of our mega gifts. But by others' measures, we would call those principal gifts. And that really at EDF drives our fundraising enormously. I mean, we really, as an organization, focus on that. We kind of punch above our weight, I would say, in terms of our performance in that area. And some of this is essentially our philosophy organizationally of marketplace of ideas, right? We believe that we have these environmental problems, we have to look to different kinds of solutions, and we partner very closely with donors in what those solutions look like and how to get there. And so a lot of our principal gift level work is really driven by that partnership with donors and how we're going to solve those problems and how we map out strategic plans and execute on those. So it's a great model for us. It takes a lot of engagement across the organization with these donors, both leading up to that kind of a commitment, and then the follow through and the stewarding, because at that, they do believe and see themselves, and they are partners in these endeavors. And so while this is driving our work, there's no question. And we do believe very strongly in the membership level and the need for building both small donors and advocates as a sign of strength in the organization. The one thing we do sometimes is kind of lose track of the middle in a way that I think we could do a better job of focusing on, specifically at EDF, and I think other environmentals do a better job of this, but focusing on those kind of high-end annual low-end major gifts in a way that that would serve us over the long term well.
Thank you. Thank you. So one of the things that Peter referenced in his remarks was the continuing growth of donor-advised funds. And when we think about individual giving continuing to be the primary driver of philanthropy in the U.S., we also know that individuals are employing different vehicles to exercise their giving, whether it's through foundations or through donor-advised funds. And be curious to hear from you, and maybe Steve, we could start with you about how healthcare philanthropies are thinking about the growth of donor-advised funds and accounting for them in their work.
Well, certainly for our systems where there's multiple hospitals, we're seeing a level of sophistication and interest in donor-advised funds in terms of wanting to be they want to open up to their stakeholders the opportunity for donors to their institutions and prospective donors to their institutions to be a vehicle for donors to set up donor-advised funds. And so, in other words, of course, institutions want to be the repository, want to be the host for donor-advised funds and receive those funds, but as a way of opening up a line of communication and making sure they have a seat at the table, we are seeing some systems that are taking concrete steps to make sure that they are the vehicle and have a front row seat with the stakeholders, and they have constant engagement with the stakeholders, even if initially the donor advised funds is not being designated for that particular hospital or healthcare institution. I think we're also seeing somewhat of a generational change as well, in that as the baby boomers age out, the next generation is expecting more performance-based results and would rather make gifts that are more targeted, more impactful, and maybe they won't stick with an institution for as long as the baby boomers, who tend to be very loyal in their giving. So those are some of my observations, but I think the watchword today is, with their limited resources, individuals really want to be impactful in terms of their giving, and they want to see measurable results.
Very helpful, Steve. Thank you. Sue or Rini, is there anything you'd like to share on the topic of donor advised funds before we go to our final area of discussion?
It's Rinny. I'll jump in quickly. I think that there are just more options for people who are wading into philanthropy. It used to be you decide you're going to start becoming more philanthropic, you start writing more checks. Now it's really, how do I manage my resources? How do I buy myself time to make better decisions? And there are more options for people. What is the tax situation for me, et cetera? And so, it's not surprising that this whole industry in the for-profit sector has popped up around donor advised funds. It wouldn't if there wasn't a need for it. But when I think about, I really think the important thing is to understand where the donor is on that continuum of options and where they are in terms of the sophistication of their philanthropic decision making. And then how we as a fundraising entity are managing those relationships. There are the individuals, the family members. If you look at various foundations and how they grew from family foundations now to big institutional foundations and several generations away from the founders and run by professional staff, just really understanding the implications for how you need to interact, whom you need to influence, how you gain access to those folks. To me, it's just a lot more nuance around your approaches to these folks and recognizing their options and how you can help them make a gift to your organization in the way that works best for them.
Well said. Thank you. Thank you. Sue, unless you'd like to share something from the case perspective, I'm happy to hear from you, or we can move on to our next question.
I think all I'd reflect, I think what Rinny and Steve have said have covered the subject really well. I think what they're illustrative of is the growing sophistication around philanthropy and around the real desire for ensuring impact. And I think it's an important part of the tapestry and the mix of how donors are seeking to do what they're doing with maximal impact.
Thank you. Thank you. Well, diversity and inclusion is a topic that is really alive in our society, and I think especially in the nonprofit and philanthropic sectors. And it would be really interesting to hear from all of you about how your organizations and sectors are engaging with diverse audiences, how you're adapting and seeing organizations adapt fundraising and communications practices, and furthermore, what communities and constituencies are you paying attention to and why? And Rinny, I might ask you to start us off here, if you could share a few thoughts about how EDF is thinking about diversity and inclusion.
Sure. So if you look at the average EDF member, it is a 65-year-old white woman. That is the profile of our average member. And so when we think about diversity and inclusion, we think about not just ethnic diversity, we think about youth. We think, about the communities that we're working with and trying to reach. So what are our connections with the environmental justice community? And I think we have the advantage as an organization to have advocacy work, and asking folks to get involved in easy to manage advocacy ways really gives us an entry point with a lot of individuals in ways that maybe organizations that don't have those vehicles have. So for instance, last year we launched an advocacy group, Defend Our Future. And Defend Our Future is really it's aimed at college students. It was about getting out the vote. And now it's about more hands-on environmental advocacy, how you do that. I mentioned the older white women. We're trying to reach younger, diverse women through what we call our Moms Clean Air Force. And we have over 1 million moms across the country who are ready to be activated within their state governments at the federal level. They were a big presence at the climate march. And so looking at really how do we create these opportunities for engagement with advocacy. Also, just in terms of EDF's mission overall, I'll give a little example if you guys will indulge me for a minute. We have actually had partnerships with some unlikely partners. I mean, it probably surprises some people to know that we work frequently with the Christian Coalition. There is, and has been for years, and now it's emerging as more of a force, the evangelical community and their concern for protecting God's creation. And so seeing where we have mutual points of interest and can work together, and to the degree to which either entity is public about that is a different issue, but thinking about like how do we reach across those barriers, but also things as, this is an interesting example, so just give me a second here. Within the community of West Oakland, which if anybody knows the Bay Area is a very, it is a very poor community. We have developed with Google and the Google cars that map all of our streets, we have developed sensors with several university partners, essentially to gather data on particulate. And what particulate matter is getting into the air. And we essentially did this with methane leaks with Google a couple of years ago. And now we're doing it because we can gather data that is finely calibrated down to the block by block level. And we're working with the environmental justice community there to see, who are very grassroots by nature, to see how they can use this data with us, working with the medical community to say, how do we overlay this with, double-blind patient, or excuse me, anonymous patient data, so that we can essentially see what the impact is, and then how we can use that to work with these groups to influence policy. So it's as much about our donor base as it is our partners in accomplishing our mission. And that West Oakland is just one example of where we are actively working. We initially had to seek these folks out, and we're actively supporting these folks in taking the data that we're gathering to ensure change to accomplish our mission.
Thanks, Rennie. A great example, and glad to hear about the work. Sue, how is the topic of diversity and inclusion finding its way into Case's work, especially from a philanthropic perspective?
Sure, thank you, and I'm glad you so excellently stewarded our time here. I'm really glad we've got to this really important area for Case. We're committed to diversity in many ways now. Our diversity mission statement says that Case aspires to help institutions connect with their diverse constituents and create pathways to current and future employees of diverse backgrounds. So this is an area of significant focus. We run a number of different diversity and inclusion programs which focus both on how we bring people from different backgrounds into advancement professions, and also how vitally those professionals and institutional leaders connect more effectively with the communities around them. And there are, the professions in which our members are working are one of the few, I'd argue, in the world where the number of professional sources is increasing. And to do so effectively, I think it's vital that people from every background are being encouraged to come into the professions, and that there's work that clearly needs to be done in this space. There was an article last week around a recent publication by William Frey from the Brookings Institute on diversity explosion, which really looks at the demographic shift happening in the United States. And in essence, he puts forward many compelling points, but in essence suggesting that there will be no single racial group in the States in the coming years that is more than 50% of the population. So the US will be a country of minority groups with none having a particular dominance. And I think this speaks powerfully to the huge richness of such a culture and such a society, and also the importance that our workforce and those we're engaging with in the context of philanthropy are from every background and from every culture. So I think this is a critically important area to be focused on and to be developing our understanding and effectiveness in.
Thank you, Sue. And Steve, in the healthcare sector, how is this topic showing up, and what are you thinking about?
Well, there's a real awareness of the shifting demographics of individuals in the United States and in Canada. And as Sue said, that's important to us and our members. And really looking at the emerging communities and how to engage them, which may take a different approach. I think number one, it starts with talent search for development offices for foundations at hospitals, hospices, and long-term care providers, and that it's important to have members of the staff that understand the challenges and the culture of the individuals that they are calling on. And traditionally, our sector has not been very diverse in terms of race and ethnic background. We're a female-dominated industry, but we really, in terms of the workforce and the individuals that participate in education in our meetings, it is not diverse. And so I know that our members are cognizant of this. So creating that pipeline and reaching out to individuals to introduce them to philanthropy in the healthcare sector is becoming increasingly important. In general, it's important and challenging for our chief development officers to find the talent that they need with the training that they have. But on top of that, they want to make sure that the workforce looks more like the communities that they serve. So developing that pipeline of talent is absolutely important. We have been doing a series of webinars on diversity for the first time at AHP and how that can affect fundraising and how to approach it. That has been well received. We're also launching a diversity inclusion committee to address some of these issues in terms of how AHP and its members can be helpful in helping people to transition. I know AFP has made this a priority, and I think they've done a really good job. AHP is moving forward. We still have more work to do, and I don't think the work will ever be finished in this area as we continue to evolve and the demographics in our country continue to shift. But having a keen awareness of it is really an important piece of the puzzle.
Thanks so much, Steve. And I'd just like to thank all of you for just sharing some really terrific insights and experiences on how, again, the data does or does not line up with your experience in the field. And we've learned a lot from you today, so thank you so much. I want to turn this now over to my colleague, Sarah Barnes, who has been reviewing a whole bunch of questions from our participants and see what we might be able to tackle before we adjourn here in a few minutes. So Sarah, over to you.
Okay, well, we have just a few minutes left, but we do have one question for Stephen Churchill. Do you foresee hospital foundations being asked to raise funds to directly support hospital operations?
I'm sorry, can you repeat the question? I had a hard time hearing you.
Sure, you bet. Do you foresee hospital foundations being asked to raise funds to directly support hospital operations?
Well, I think that for the first time, the CEOs of hospitals are looking to and relying on foundations at hospitals to help them with their bottom line. I think traditionally, hospital CEOs, unlike the university presidents, have not placed a high priority on philanthropy. They've had other priorities within their organization. I think that they will be that the funds raised will be asked to support a variety of functions, but I think they will be specific in nature rather than the overall bottom line, simply because it's more compelling for the donor to give to a specific initiative than it is to a broad general bottom line. But this is just conjecture on my part, and so I don't know what the future would tell, but I think organizations will be more successful if they have a specific initiative in mind versus something that is more generalized.
Okay, thank you. And now I'm going to unmute Stephanie Lynch. She is located in Portland, Oregon. She has a question to ask you, Peter, I believe, regarding the data. Stephanie, are you there?
I am. So I was just thinking back to the data that was presented, and I'm wondering if organizations are represented twice in different categories. So, for example, I work for the Providence Medical Foundation, and I could see us falling into several categories. So we could fall into the foundations, the religion, or even the health categories. And so I'm just wondering how that's factored into the data that's presented.
Thank you. That's a very good question. And needless to say, we don't want to be counting dollars twice. And we think we do a pretty good job of making sure that dollars are not counted twice in the research methodology. There is a little bit of room for error that's in the 2 to 3% range that what we call unallocated giving, and that is really the difference between where we've allocated giving and what the results are. So, but typically, for instance, a hospital foundation would be counted in healthcare, even if it has religious affiliation, unless it's controlled by a diocese or some other religious entity. Medical research done at a medical school that might be connected with an academic medical center tends to be counted in education rather than healthcare. So you're right, there are some nuances, and sometimes things get counted in a category that might seem counterintuitive to some, but we're pretty sure that there's very little double counting.
Thank you.
Thanks, Peter. A question. We'll just take just a couple more, and then we'll be set. But is the increase in international giving potentially a result of an increasingly diverse U.S. population and/or issues such as the refugee crisis?
We think that both of those are true. So you can see a relationship, just as I noted in the human service category in this country, you can see a relationship in large international disasters and giving to international entities. And so those two things are clearly related. We also believe that, in addition, that we also believe that to some degree the multiculturalism of the United States might be connected to the rise in international giving. There's evidence to support, it's anecdotal, it's not in the Giving USA research, but there's some evidence to support that the millennial generation sees itself more as a resident of the planet than of a particular community, and that group is inclined to give to international organizations more than prior generations have. And then finally, as I noted earlier, we think that the growth is related to the growth in the number of the organizations doing that. Okay,
thank you, Peter. And so we are at the close of our time here, and a big thank you to everyone who joined us today, and a special thank you to Rinnie, Sue, and Stephen. If you have additional questions, you can feel free to reach out to Peter or Kate. And as you'll see on your screen, there is some instruction on how to receive the complimentary executive summary of the Giving USA 2017 or the other products offered by Giving USA. And you can use the code Campbell to receive 30% off of any Giving USA product. And from all of us at Campbell & Company, we hope you have a wonderful summer. We'll be in touch. Thanks so much.